Simula ng pagkalat ng sakit na COVID-19 sa iba't ibang parte ng mundo, ay nagsimula ring maghanap ang mga eksperto ng bakuna laban dito. Sa ngayon, nagtulungan ng pamahalaan at mga kumpanya mula sa iba't ibang bansa at ginawang prioridad ang paggawa ng bakuna. Matapos masiguro ng Philippine Food and Drug Administration o FDA na ligtas ang bakuna, mabibigyan nito ng Emergency Use Authorization para magamit ng gobyerno. Ang bakuna ay gawa sa hindi na aktibo o inactivated, pinahina o weakened, o mga pinatay na kopya ng buo o piling parte ng pathogen. Mahalagang maunawaan na ang mga katangian nito ay iba sa orihinal na virus at hindi ito nagdudulot ng sakit. Ang pathogen na sanhi ng sakit ay maaaring isang bacteria, virus, o iba pang microorganismo. Kapag naibigay ang vaccine sa katawan, ay naguhudyat ito ng isang natural immune response kung saan gumagawa ng antibodies ang katawan sa paraan ng pagkuha ng mga piling parte ng microorganismo at pagproseso nito para hindi na siya nakakahawa. Ginagaya ng isang bakuna ang mga pathogen na nakadudulot ng sakit upang ma-stimulate ang natural immune response ng katawan. Ginagaya ng bakuna ang proseso ng pagkakaroon ng sakit at pagbuo ng antibodies na hindi kasama ang mga masasamang sintomas at epekto. Ang layunin ng mga antibodies ay protektahan ng katawan natin at labanan ang mga virus o bakterya. Kapag nakagawa na ng antibodies ang katawan natin, kinukode ng ating memory cells ang microorganismo upang madali itong maalala at mamukaan ng katawan. Ngayon na alam na ng mga memory cell ang itsura ng virus, kaya nang gumawa agad-agad ng katawan natin ng antibodies kapag nahawahan tayo ng totoo, buhay at buo na virus. Importanteng maalala natin na malaking tulong man laban sa COVID-19 ng pagkakaroon ng vaccine, hindi ito gamot o luna sa sakit na ito. Kahit may bakuna na, kailangan pa rin nating sundin ng mga minimum public health standards para mas mabawasan ang pagkakataong mahawahan tayo ng COVID-19. Sanitize lagi ang kamay. Magsuot ng face mask at face shield. Dumistansya ng 1 metro at panatilihing malusog ang sarili at matibay ang resistensya upang maiwasan ang pagkakasakit. Laging tatandaan, prevention is still better than cure, kaya naman patuloy lamang ang pagsasagawa ng preventive measures. Together, we can beat COVID-19. Together, kaya natin to be the solusyon sa COVID-19.
Ito ang Fast 5. Mayroon tayong 5 minuto para tanungin ang mga eksperto tungkol sa COVID-19.
Hi everyone, I'm Dr. Anna Ong Lim and I'm with the DOH Technical Advisory Group.
Anong mga sintomas ng COVID-19 ang pwede i-treat sa bahay?
So napakagandang tanong. Ang mga mild symptoms, pinakakaraniwan pa rin siya sa mga nararamdaman ng mga taong nagpa-positive sa COVID-19. Kasama na dito yung lagnat, ubo, sipon, pananakit ng katawan, yung iba nagtatae. Pinaka-importante talaga is bantayan yung hirap sa paghinga kasi once sumumpong na yon, hindi na natin pwedeng sabihin mild and definitely kailangan na siguro din makita sa ospital o makita ng kanilang doktor.
Paano natin malalaman kung pwede tayo mag-home isolation?
Magandang mapag-usapan ng home isolation kasi lalo na ngayon, no, maraming mga taong nasa mga TTMFs or quarantine facilities or even sa hospital. And for as long as yung ating pamamahay ay may sariling lugar or isang silid na kung saan pwedeng mamalagi yung may sakit, and mas maganda rin sana na may sarili siyang magagamit na banyo,
Ano naman ang pwede kong gawin kung meron akong lagnat?
Ang lagnat ng COVID is not any different kumpara dun sa lagnat na nadala ng ibang sakit. Ang kino-consider natin na may lagnat ng isang tao pagka ang kanyang temperatura ay 37.5 pataas. Now, typically, kung meron tayong lagnat, iniinuman lang naman natin to ng paracetamol. Karaniwan, isang tableta tuwing ika-4 hanggang ika-6 na oras.
Ano naman ang home treatment para sa sore throat?
Ang sore throat, karaniwan, ginagamot lang natin yan using supportive care. So tulad na lang ng saline gargles or pagmumog no, ng water na may konting asin, o kaya pwede ring gumamit ng mga menthol preparations or menthol candies para lang medyo maibsan yung pananakit ng lalamunan.
Ano naman ang warning signs ng paglala ng mga sintomas?
Ang pinaka-importanting bantayan sa mga simptomas na lumalala na related to COVID-19 is really yung hirap sa paghinga. Pwede rin yun na rin na magdala nung confusion. Pwede rin yung mga simptomas tulad ng sobrang panghihina kasi halos hindi na makakain, hindi makainom. No? So yung mga ganong klaseng signs, kailangan siyang masubaybayan ng healthcare professional.
Paano ko naman maiiwasang mahawaan ang mga kasama ko sa bahay?
Pinaka-importante dun sa iisipin natin pag tayo nag-isolate is dapat talaga nakabukod tayo sa ibang tao. So, dun lang tayo sa ating silid, dun na tayo kakain, hindi na tayo lalabas hanggang makatapos ng 10 araw. Now, kung tayo naman ay nasa isang lugar na shared bathroom pa rin ang ating ginagamit, sana yung surfaces ng banyo, tulad nung yung doorknobs, yung faucet, yung pinaka-surface ng lababo, at saka yung pinag-upuan natin sa inidoro, pupunasan muna natin yan bago natin iwanan ng banyo para yung susunod na gagamit, hindi naman mahawaan ng ating mga secretions o yung mga tilamsik ng ating laway kung sakasakalit naman ay tayo ang gumamit ng banyo.
Sino po ang pwedeng kausapin kung may karagdagang mga tanong pa ako?
Maraming resources sa ating mga communities at napakaraming health workers na handang tumulong. No? So unang-una na siguro doon yung ating mga BHERTs, no? Sila naman ay naabisuhan, o yung mga midwives or nurses sa ating community, even our local health center physicians, they're always ready to help us with our questions.
Maraming salamat, Doc Ana. May mga paalala pa po ba kayo?
Karamihan pa rin naman sa mga kababayan natin ng pa-positive for COVID ay nabibilang dun sa mild and asymptomatic category. So, mukha namang kaya, no? Most of the time, nababantayan itong ating mga kapamilya within the home. Ang importante lang, siguro, habang maaga, meron ng link to telemedicine o kaya nakausap natin yung ating mga barangay or community healthcare workers para kung sakasakalit medyo lumala yung lagay ng ating kapamilya ay nakaset up na kung anong susunod nating gagawin. Maraming salamat sa inyong lahat and mag-ingat po tayo.
Bida Solusyon Plus laban sa COVID-19.
Paano nilalabanan ng bakuna ang sakit? Pinagay ng bakuna ang virus o bakterya na nagdudulot ng sakit at naguhudyat ng paggawa ng katawan ng antibody. Ang mga antibody ang siyang magbibigay proteksyon sa pagkakataong mahawa ng aktwal na virus o bakterya na nagdudulot ng sakit. Tara! Sa Bida Vaccination! Paano nagkakaiba ang mga bakuna? Nagkakaiba ang mga bakuna kung saan ito gawa at kung paano ito naguhudyat ng immune response para gumawa ng antibodies. Itong antibodies ay panlaban sa microorganismo na kalaunan ay magiging proteksyon laban sa totoong impeksyon. Ang bakuna ay maaaring pinahina o patay na organismo o isang genetic product tulad ng mRNA na gagawa ng protina ng isang virus o bakterya nang hindi nagdudulot ng sakit. Tara! Sa Bida Vaccination! Ano ang maaaring antabayan ng side effects matapos magpabakuna? Maaaring makaramdam ng pananakit, pamumula, pangangati, o pamamaga sa parteng binakunahan na maaaring magtagal ng ilang oras. Lagnat, panghihina ng katawan, pananakit ng ulo, pagkahilo, pagtatae, o pagduduwal. Agad na sumangguni sa isang healthcare professional kung makaranas ng alinman dito. Tara! Sa Bida Vaccination! Kailangan bang magpabakuna ang lahat? Hindi sa pilitan ng pagbabakuna, ngunit hinihikayat ng gobyerno na magpabakuna ang publiko para maprotektahan mula sa sakit na maaari namang maiwasan. Tara! Sa Bida Vaccination!
Lung cancer is the most common cancer worldwide, and it is the second most common form of cancer in the Philippines. It is a form of cancer that starts in the lungs and can spread to other parts of the body. 90% of lung cancers are caused by smoking or tobacco use, and the screening tool for lung cancer. In addition, the Lung Care Clinic also helps patients quit smoking through the Start a New program. For patients and their families who are facing the reality of lung cancer, the journey is hard. But it doesn't have to be a lonely or hopeless one. And because lung cancer diagnosis often prompts a second opinion, our medical team reviews and discusses diagnosis and treatment with the patient and their attending physician. Our medical team takes into consideration the uniqueness of both the patient and their disease, even up to the molecular level. By embracing this uniqueness, we are able to offer treatments that are tailor-fit for each patient. Taking a holistic view of the patient's health, we offer supportive care. This includes rehabilitation services along with nutrition, as well as psychological and family counseling. The Medical City's Lung Care Clinic gives patients the tools to deal with lung cancer through cutting-edge medicine and compassionate care. We offer a fighting chance. We offer a helping hand. We offer hope.
So we need to engage in self-care, which means to take care of our bodies, eating right, exercising, engaging in wellness activities like meditation and breathing exercises. There are many ways that we can do this. As to eating right, the foods that we choose to nourish our bodies and the way we enjoy them can have a tremendous impact on our mental and physical health. So, when you're at the grocery, be purposeful. When you're restocking, pick up foods that boost your mood, maybe like oatmeal, nuts, dark chocolate, in small amounts. Sleep plays a major role in our overall health, improving our emotional regulation and management of our anxiety. So it's very important to get 7 to 9 hours of sleep, especially during times of stress. To get that, try to limit your exposure to news and social media a couple of hours before bed. Exercising increases energy levels, improves happiness, and doesn't have to take place in a gym. So maybe take a virtual workout, maybe at home, take a class. Or if it's possible in your area, spend some time outdoors, walking or biking. Finally, the practice of pausing, breathing, and just being is essential to our well-being and mental health because it helps us reduce stress, worry less, and it enhances feelings of resiliency. So practices like mindfulness meditation, yoga can be very good practices for self-care.
Hello, I'm Dr. June Ruiz, a Philippine and American board-certified gastroenterologist and lead advocate for colorectal cancer screening at the Medical City. We at the Medical City aim to be at the forefront in the fight against colorectal cancer. It is now the third most common cancer among Filipinos, yet it is one of the most preventable and treatable cancers. Colorectal cancer is a malignant tumor that occurs in the large intestine, either in the colon or rectum. It is simply called colon cancer. This figure shows the colon in our abdomen and is around 5 feet long. The rectum is the portion that connects the colon to the anus. Abnormal growths, called polyps, may form in the colon or rectum. As these polyps can be precancerous, they may turn to cancer in a period of several years. The removal of these polyps greatly reduces the risk of the person developing colon cancer. Some patients with colorectal cancer may experience no symptoms, especially in the early stages of disease. When symptoms occur, this may vary depending on the cancer size and location in your large intestine. The signs and symptoms of colon cancer include rectal bleeding, changes in bowel habits like new diarrhea or constipation, abdominal pain or bloating, anemia, and unintentional weight loss. There are factors that may increase your risk of colorectal cancer, and these include age 50 or older, personal history of colon cancer or advanced polyps, family history of colon cancer among first-degree relatives, lifestyle habits such as cigarette smoking, significant alcohol consumption, obesity, a diet rich in saturated fat, low fiber, high red meat consumption, and conditions like inflammatory bowel disease. Persons whose only risk factor is age greater than 50 are considered average risk. Cancer screening looks for cancer before the person experiences any symptoms. Screening can find cancer at an early stage, when there is a great chance for cure. When colon cancer is found at an early stage, the 5-year survival is around 90%. The current guidelines recommend the start of screening for average risk patients at the age of 50. Those with family history of colon cancer should be screened at the age of 40 or earlier if indicated. The gold standard in colorectal cancer screening is a colonoscopy. The procedure involves a flexible fiber optic instrument with a camera inserted through the rectum and advanced to the entire colon. It can detect and remove polyps before they turn to cancer, as well as biopsy abnormal areas. This is done under light anesthesia, where the patient is comfortable during the procedure. Some patients may not want to undergo an invasive test that requires intensive bowel cleansing with laxatives. However, there is an alternative, a stool test called Fecal Immunochemical Test or FIT. FIT detects human blood and is specific for bleeding in the large intestine like colon cancer. If the stool is positive, a colonoscopy is needed. If the result is negative, then the test is repeated every year. FIT is a good screening test. Living a healthy lifestyle can lower your risk of colon cancer. Eating a healthy diet that is high in fiber, low in processed meat, regular exercise, smoking cessation, not consuming excessive alcohol, all of this can lower the risk of colon cancer. Colorectal cancer is preventable, treatable, beatable. If you or your loved ones are at risk for colorectal cancer, visit us at the Medical City. Talk to one of our doctors about the screening process.
In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Father, our greatest healer, we thank you for this brand new day that you've granted us, and for the opportunity to celebrate life once again, together with our loved ones, all in one piece. Tonight, we pray to seek your face and intervention as we battle against an unseen enemy. To help us to be prepared in these times of uncertainties, provide us wisdom, Lord, that we could be able to defend ourselves, and influence others against the threat of COVID-19. Increase our faith in you and teach us to fear none but you. And while we are in the middle of this battle, we already claim our victory in you, Lord. We also pray for our frontliners. We pray for strength and a firm heart. We thank you, Lord, for giving them the courageous hearts of heroes. Please envelope them with your protection and prevent them to contract the virus. Strengthen their loved ones so they could always receive inspiration and motivation. We also do pray that they may receive the appropriate privileges they deserve for all their invaluable sacrifices. Please unite us, Lord, so that their efforts will not be led in vain. We pray for those who have contracted the virus. Help them recover and comfort their family during these trying times. Provide all their needs in all aspects so that they could be able to restore all the damages and losses that the virus has caused them. We pray for the swift progress of the vaccination to the whole world. Let the cure reach even the ends of the lands so that everyone can be inoculated with the vaccine without compromising their health. Send more people to educate everyone on what is the truth about the vaccines. Touch the hearts of those who doubt and make them trust the capacity of our medical professionals. We also pray for the flow of this program. May this event foster not fear, but knowledge so that everyone can be educated and equipped in fighting COVID-19. May your name be glorified in this event. This COVID-19 may keep on mutating and changing, but you are constant forever, so our hearts will trust in you more. To you be the highest glory, dominion, and authority. We ask all of these in the beautiful name of our Savior, Jesus Christ. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Good evening, our dear friends, to the DMCI officers, neighbors, guests, and everyone watching this webinar in the whole of DMCI community. Welcome to our forum entitled COVID-19 Vaccines Defending Against the Delta Variant. I am Dr. June Ruiz, a Philippine and American board-certified gastroenterologist from the Medical City, the Programs and Advocacy Officer of the Cancer Institute of the Medical City, a strong advocate for colorectal cancer screening, an author, occasional journalist, and a member of the Community Development Council of the Flair Towers. I am also the founder of the Flair Towers Health Advisory Task Force for the Property Management Office, or the PMO. This is a group of volunteer physicians who are residents of the Flair Towers who provide their expertise, their free time, and dedication to assist the PMO in health matters that benefit the community. If you are a physician, a nurse, an allied medical personnel, or concerned citizen who are interested in joining us, please contact your PMO or email us at theflairhealthtaskforce@gmail.com. During the recent oath-taking of the new set of members of the Flair Towers CDC, Senior Vice President of DMCI Management Corporation, Mr. Enrico Wong, suggested having an educational activity on important health matters where we can provide facts, expert opinions, and guidance for the community. We took the challenge and joined the Health Advisory Task Force in cooperation with Mr. Kevin Dilan, our hardworking DMCI Community Development Manager, in coming up with the first ever health webinar from DMCI or from any Philippine real estate developer for that matter. We chose a topic so timely that you will learn and appreciate, and we hope you will enjoy this pioneering educational forum. This is our small contribution in the fight against COVID-19. To give the opening remarks is our operations manager of the DMCI Property Management Corporation, is Mr. Frederick Rapinan. Hello, Sir Yet.
Dear DMCI Homes Communities, welcome po sa importanteng webinar natin ngayon. Timely and relevant webinar to have during this time of pandemic. Maraming salamat po sa oras na binibigay nyo. Unang-una sa lahat, maraming salamat sa pag-attend. Maraming salamat din sa ating mga volunteers in making this webinar happen. I hope that everybody will benefit in this webinar. Maraming salamat po at welcome ulit sa inyong lahat. Maraming salamat po sa oras na binibigay nyo. Unang-una sa lahat, maraming salamat sa pag-attend. Maraming salamat din sa ating mga volunteers for making this webinar happen. I hope that everybody will benefit in this webinar. Maraming salamat po at welcome po sa inyong lahat.
Thank you, Sir Yet, for that wonderful message to the DMCI community. For our very first health webinar, hopefully not the last, we present a very timely and exciting topic. This is on COVID-19 vaccines, defending against the Delta variant. For our audience, you can post your questions for our guest speaker in the comment sections of our YouTube channel. We will try to accommodate all the questions during our question and answer portion as long as we have time. This pandemic has completely changed our lives. It has been 17 months since we started a lockdown in the country on March 16, 2020, and it's the longest in the world. Our lives would never be the same again. We drastically altered the way we work, the way we socially interact, and everything else. And this is practically from an invisible foe, a virus known as SARS coronavirus 2, the causative organism of COVID-19. For all of us, this was a time to reflect on our lives and priorities, placing God, family, and health as the most essential. Some of us and our loved ones may have gotten sick from the disease. Sadly, some of them died. National economies were crippled and took a nosedive, and the healthcare system was on the verge of collapse. To date, this pandemic has infected almost 1,800,000 Filipinos, and more than 30,000 of our countrymen had already died. Today, we had the worst news. We had the highest record for new cases in a single day of 17,231. However, we remain hopeful, especially when we thought we saw the light at the end of the tunnel when the vaccines arrived in the Philippines. The first dose was given on March 1 at the Philippine General Hospital. Since then, many of us had decided to get vaccinated for our safety, for our families, and for our nation in achieving herd immunity. I hope every one of you listening to the webinar has already gotten your shot. Then came the mutants, or what we call the variants. First, there was Alpha, then Beta, then comes the feared Delta. Now there is even a Lambda variant. Delta has become a game changer. I am scared of the Delta variant, and so should you guys. And there are numerous reasons why we should fear Delta. Number one, Delta is more contagious and easily transmissible, 3 times faster than the original strain. Number two, Delta can cause a more severe illness because the viral load is 1,000 times higher than before. Number three, despite us being vaccinated, we can still transmit the virus to others. Number four, in spite of vaccination, we have patients developing what we call breakthrough infections. And number five, sadly, Even significant numbers of children are getting sick with the Delta variant. Despite all of this, the bottom line is widespread vaccination is still a critical tool to stop the pandemic. Our guest speaker will try to convince us of that conclusion. Our esteemed speaker is Dr. Annalisa Onglin. She graduated from the University of the Philippines College of Medicine and subsequently took up her pediatrics residency and infectious diseases fellowship at the UPPGH. She is currently the chief of the section of the infectious diseases and tropical diseases at the PGH. As part of the Philippine COVID-19 response effort, Dr. Anna serves as a member of the Department of Health Technical Advisory Group and the IATF Technical Working Group on COVID-19 variants. That is why you see her on TV explaining just the facts in a very crystal clear manner. We need to listen to the right experts so we know fact from fiction, the truth versus fake news. It is with great honor and privilege that I present an esteemed colleague from the Walang Katulad class of the UP College of Medicine and a very good friend. Ladies and gentlemen, let us warmly welcome Dr. Anna Ong Lim.
Good evening, June, and good evening to the DMCI community. I hope I'm coming through clearly. Can I just have feedback from the tech team? I'm coming through clearly. Okay.
Yes.
So as Dr. June has said, we do really have a significant problem with COVID as well as with the Delta variant. So for this session, what I'd like to do is just to run through some of the current information very quickly and use this as a backgrounder so we're all on the same page and give everybody a chance to clarify some of the information that they might be hearing about COVID and about the variants and about vaccination. We are on the last day of the ECQ here in the National Capital Region, and this was actually declared to cover the period between August 6 to 20, following a fairly long period of GCQ with heightened restrictions that was imposed also on the National Capital Region in response to the growing number of cases. If we look at this graph, we know that we actually have just come from a surge, which happened in the tail end of March, all through April. And if you will look at the very steep rise, followed by the fairly steep decline, you'll see that it took about 2 months before the numbers comfortably had gone down. However, this slight uptick in late July, early August had a lot of people worried. And if you were to think about it, you would say, bakit ka naman kakabahan? Parang napakakonti naman ito kumpara dito sa pagtaas ng mga numerong ito. At kakatapos lang naman natin ng period where we were reporting 8,000 cases a day. Ano ba naman yung konting pag-akyat na yan? So the reason why everybody was worried was that this was happening in the context of these reports coming from the Philippine Genome Center. You will see that as of July 28, a total of 216 cases had already been reported. And in itself, it's a very concerning number, knowing what we had heard at that time about Delta. But really, the main source for concern was not the numbers per se, but really what they were indicating in terms of transmission. The first batch of Delta positive cases were reported the last week of June and covered samples that had been collected between March and June of this year. And the 17 cases that were identified came from a batch of returning overseas Filipinos. They were seafarers, and I think most of them were among a group who were on the MD Athens Bridge. Now, because These were all returning travelers and no onward transmission had been detected. We, at that time, were quite gratified to see that the border control measures that had been implemented in anticipation of the entry of Delta and other variants seem to have controlled the entry of these particular variants of concern. However, because we do know that no system is foolproof and that it was impossible to actually seal our borders tight, these measures continued to be implemented. There was a lot of reminders across the different ports of entry that the protocol should be complied with. But unfortunately, that last batch of detections leading up to the July 28th report actually showed several cases for which no history of travel could be identified. And so with that, it was realized that local transmission could no longer be denied. And so with that, together with the uptick of cases, this was really the stimulus that led to the declaration of the ECQ covering the previous 2 weeks. So as we are now looking at increasing cases that we think are primarily being driven by the variants, it's very important now to talk about what they are, why they're important, and how can we be protected. Variants are simply mutations. And for any living organism, replication or continued propagation brings with it the challenge to faithfully reproduce the genetic code such that generation after generation after generation continues to show this same pattern. Each time a virus spreads, the sequence is copied, and faithful reproduction assures that the virus can continue to have the same qualities as its forebears. Now, there are times where replication brings with it some changes, some minute changes, or even some major changes, but these do not necessarily bring about any significant change in the way the virus behaves. However, there are some variations that bring a survival advantage. In this diagram, we see that instead of reproducing just once every generation, now we have a change that confers an increase in reproduction. And so whenever these variations bring about changes that improve transmission, resistance, capability to evade immune mechanisms, these will allow the virus strains to thrive and propagate even better. And if we think about it, this is really the objective of any living organism, to attain these changes that make them fit, fast, formidable. Knowing then that transmission is one of the key factors for the creation or the arrival of mutations, we have to realize that one of the keys to ensuring that we control coronavirus or any virus is to prevent the risk or to prevent spread. The higher the number of cases, the higher the risk of mutations, the more a virus spreads, the more chances it has to mutate. So these thousands of little changes that happen in its genetic material, although initially may not have significant impact, will eventually accumulate, will eventually select out those strains or those mutants which are able to dominate the cohort that's spreading, and therefore will eventually become the form that is most easily or the most readily detectable. Not all the changes, as I mentioned, actually have significant impact, but those which confer an increase in transmissibility or virulence, have been called variants of concern. And the WHO has come up with this uniform nomenclature or naming system to help us all when we refer to these variants. We have the Alpha variant, which was first detected in the UK in December last year, followed shortly after by the Beta variant, first detected in South Africa, also at about the same time frame. The Gamma variant, first detected in Brazil, was reported in January, while the Delta variant is the one that was first detected in India following their surge last May. There are also what we call variants of interest, which are just starting to show up as clusters or as limited community transmission or as detections in multiple countries. Not to the same extent as VOCs, but certainly bearing close watch. In this list of variants of interest, we will see P3, which was first identified in the Philippines in Region 6 last March, but which has now been dropped from the list of variants of interest. And I illustrate this just to show that not because something shows up as a VOI, will they necessarily become a VOC at a certain point in time. So now with a lot of interest being shown for Lambda, which is a VOI, we just still need to observe what happens next to understand whether they will eventually become a VOC or, like Theta, be dropped from the list of variants being observed. This map shows us the extent of spread of the different VOCs, and we see that Alpha is now detected or was detected in 180 countries, Beta in 130, Gamma in 78 countries, and Delta in 124. Now, this is a map that was published mid-July, or rather towards the end of July, and very shortly thereafter, not even 2 weeks after, there was further spread of Alpha in 182 countries, Beta in 131, Gamma in 81, while Delta, in a very short period of time, spread further to 8 more countries to be detected in 132. So this is actually illustrating how transmissible this particular variant is and why there's such a lot of attention being paid to it globally. Now let's go to the next question of why are they important? This diagram shows us an illustration of some of the more important mutations that are found in Alpha, Beta, and Gamma variants. They share the Neely or the N501Y mutation as well as the E484K mutations, which are thought to be key to helping the virus spread more easily or affect the antibody response. The Delta variant, on the other hand, has a unique set of mutations, the P681R and the L452R, which are thought to help the variant spread more quickly. Whatever these mutations are, we expect for these to continue happening as the virus continues to spread. And once again, understanding that spread is the key to variation and mutation, we now have a target to actually focus on so that we prevent further variants from coming to the fore. If we are able to control the spread, we're able to tweak the vaccines, we're able to get people to behave in such a way that prevents transmission, then these particular combinations of actions will help us to prevent further variants from coming up and infecting our global community. Among the important qualities of Delta that have been identified include the fact that the viral load for patients with Delta infections are typically 1,000 times higher than that of the wild type virus or the original strain. And because of this, we expect that the interval from exposure to a positive PCR result is slightly shorter for Delta compared to that of the non-VOCs, so in the order of 1 to 2 days earlier based on their observations. There's also data that tells us that Delta variants may have increased virulence because in a study from Canada analyzing over 200,000 cases, they saw that the risks for infections, rather the risk for hospitalization, ICU admission, and death, if a person is infected with Delta, is over 120%, over 287%, and over 137% compared to the non-VOCs or the non-variants of concern. Now, let me just give a little bit of extra food for thought for this data. Knowing that it is more transmissible also means that we expect more people to be affected and infected. This will include more elderly individuals, more people with comorbidities. And it's very difficult to actually tease out whether the fact that we have more people being infected is actually driving this increase in hospitalizations, ICU admissions, and death, rather than the actual virulence of the organism. So in any case, this still bears watching because the data does tell us that there is more a risk for more severe disease. Another significant impact that Delta has brought about is its role in increasing the herd immunity threshold. Herd immunity has been the target of vaccination programs globally because when we achieve a certain proportion of the community being vaccinated, we hope that this coverage will prevent further spread of the virus, even if we are not able to vaccinate 100% of the people in a community. So based on computations, the wild type or the original COVID-19 strain with a reproduction number of 3, meaning for every positive individual, you have 3 people infected, required a herd immunity threshold of about 70%. The alpha variant, which was expected or is expected to infect 4 for every positive individual, necessarily required a higher herd immunity threshold, and this was pegged at about 75%. Now, what do we know about Delta? Its reproduction number averages about 6. The range is 5 to 8. And because of that, we need to target an even higher herd immunity threshold, now at 83%. Now, let's go to the last question, which is how can we be protected? The country has instituted systemic responses as well as responses that we can implement on an individual level. I mentioned the border control strategy, which was very critical at the onset, or rather at the start, where strengthening border control was key to preventing the entry or delaying the entry of the Delta variant by about a month or a month and a half after it had been detected in India. We continue to implement border control, and I'd like to appeal to everybody in the community. If you hear people complaining about the need for quarantine, the reason why this has to be continued is precisely because we want to keep variants out of the country. Delta will not be the last. We expect even more to arise as the virus continues to spread. And getting everybody to cooperate with these quarantine measures will be helpful in preventing entry of new variants of concern. We know that our border control measures include facility-based quarantine for 10 days, followed by 4 more days of home quarantine. And the process here involves an endorsement from the quarantine center to the local government unit for the remaining 4 days of home quarantine. The LGUs need to be able to implement this strictly, and we as citizens need to comply. We need to make sure that the remaining 4 days of quarantine are served so that that incubation period or the period over which symptoms can arise can be observed closely. If we happen to belong to a community for which localized or granular lockdowns have been implemented, it will be very important also to comply to prevent the spread of infections within the area. We continue to implement genomic biosurveillance. The reason why we're able to identify Delta as a variant of concern from cases who are positive is because there is a system of collecting samples from different regions and running them through what is called a whole genome sequencing platform. These tests are not done to impact on the individual's management, but rather to help us make decisions about policy for quarantine and isolation. So we don't really expect these tests to be done at point of care, and we don't expect these tests to return within the next 24 to 48 hours and impact the management of the patient who is currently in the hospital or who is currently isolated. So it is not a test for individual management, but rather a test that helps us make decisions for policy. We continue to need enhanced genomic biosurveillance so that we can keep a step ahead of these variants and when they come into the country. It's also very important to improve the healthcare capacity to be ready for any surges. And in fact, this was being done at about the time when the problems in India had been observed. So there was a rapid review of resources available, areas which were actually noted to have very small hospital and ICU capacities were urged to create more beds. There was a mapping of resources, including oxygen tanks, that helped us to project which areas needed additional supply and from where these extra supply could be obtained. Another system response is actually strengthening the implementation of the prevent, detect, isolate, treat, and reintegrate strategy by the local government units. But one important thing that we can contribute as individuals is really to be very conscious about decreasing the time between onset of symptoms and being tested. At a certain point in time, the lag between onset of symptoms and figuring out that a person was actually COVID positive had stretched to about 9 days. Imagine that for that 9-day period, the individual was actually going around, interacting with people at work, with his family, with his community. And that is not acceptable. We want to keep this turnaround time between onset of symptoms and detection to as small as possible, and if possible, within 48 hours. So what do we as individuals do? What we should be, or rather we should actually be isolating immediately in case we feel any symptoms that might overlap with COVID. The next step is actually to inform our household members that they should also practice quarantine and limit their movements while arrangements are being made for testing to be done. So this 3-step protocol will actually be helpful in ensuring that people don't spread the disease around more than they already have before being identified as positive for any COVID virus. Now, if in case the test is negative, then the next step is actually to find out what is actually causing the symptoms. Because let's remember that there are many other illnesses out there which overlap, the symptoms of which overlap with COVID. We have a lot of dengue cases. We recently had floods, and leptospirosis is also on the rise. So at the outset, these symptoms look like each other, and even if we don't have a COVID positive test, it's entirely possible that some other severe illness could be presenting as the initial symptoms that you're feeling. Another component of the PDITR strategy that we can participate in as individuals is actually to comply with triaging and prioritize admission of severe and critical cases to preserve healthcare capacity. Although we are usually of the mindset that when we are sick, we want to be admitted, it's actually possible, no, to manage mild and asymptomatic cases at home and reserve the bed capacity of the hospitals for severe and critical cases who will be needing a hospital admission. So this compliance with the triaging system, where we allocate, no, the hospital beds to those who need them the most, will actually be very important in preserving the healthcare capacity. We're reminded that it's very critical to comply with the minimum public health standards, especially the correct wearing of a face mask and face shields, physical distancing, as well as avoiding social or mass gatherings, which are potential super spreader events. I'd just like to show you very briefly a video that may help us understand the concept of ventilation and how it impacts on the spread of the virus. So let me just show this video very quickly.
COVID-19 virus ay airborne, kumakalat sa hangin. Hindi lang ito nasa talsik ng laway o sipon na mabilis din ito sa hininga na tulad ng usok, lumulutang sa hangin, naiipon pagtagal at lumalayo. Ano bang ibig sabihin nito sa mga paraan ng pag-iwas? E di pareho din ng pag-iwas sa usok. Sa bahay, pag naipon ng usok, magbukas ng bintana o pintuan at pagalawin ang hangin palabas. Sa loob naman ng sasakyan, buksan din ang mga bintana para dumaloy ang hangin. Sa trabaho, ganun din. Laging buksan ang mga bintana at pintuan at pagalawin ang hangin palabas. Higit sa lahat, kung may gagawin tayo at kaya naman, piliin ang hindi kulog na lugar. Kung tulong-tulong tayo sa pag-iwas, kaya nating talunin ang COVID-19. Isang munting paalala mula sa inyong healthcare workers.
So I hope very short video helped to clarify the need for utilizing ventilation as an additional layer of protection, because if virus particles are suspended in the air and they're allowed to stay there, then it can be a means of transmission. Finally, the one critical addition to our response, which was not available in the previous surges that we went through in July of last year and even earlier this year in March and April, is really the availability of vaccines. We know that vaccines are key for the control of many infectious diseases, and COVID is not an exception. Vaccination has been thought or is going to be the major difference in terms of being able to control this pandemic. And that means that we need for everybody who qualifies to be vaccinated at the soonest possible time. Now, there are some people who may still be hesitant, and I'd just like to show you the data coming from different countries just to encourage everybody, to participate in this program. This graphs or these diagrams show us that for countries where vaccination coverage has been small, for example, 1.2% in Namibia, or 2.5% in South Africa, or even in Russia with 13.6%, the number of cases represented in blue actually parallel the number of deaths represented in red. So the peaks that you see with the number of cases reflect the number of deaths that you eventually expect to have. However, for countries where the population has already been highly vaccinated, such as the UK or Portugal, you will see that even as they report cases, these are significantly lower compared to the periods in time when the vaccination program had not yet been going on, and their deaths are hardly seen. So here you don't see any more red bars, nor do you see red bars or hardly see any red bars for Portugal. So what we want to happen actually is to achieve as high a coverage of our community as possible so that even if infections continue to happen, those who are at highest risk, meaning our seniors, those with comorbidities, are protected so that infections don't translate to deaths and don't translate to a high demand for the healthcare capacity. If we're able to do that, then there will be a lower need for further ECQs to have to be implemented. Now, there may be some of you who are hesitant to be vaccinated because of the concerns about adverse events. So let me show you the data coming from our National Adverse Event Following Immunization Committee, or the NAFIC, which had documented 12 million doses distributed as of the date of this chart, which is July 4, 2021. So out of the almost 12 million doses distributed at that time, about 47,000 individuals reported adverse events, and this represents 0.41% of the total doses administered. Of these 47,000 or so adverse events reported, the majority, about 46,000 or 98%, are non-SAEs, or they're mild adverse events, typically belonging to categories like headache, vaccination site pain, fever, dizziness, or even increased blood pressure as driven perhaps by anxiety. A very small number, about 1,000 or 2%, are serious adverse events. When we talk about serious adverse events, this will mean people who were hospitalized for reports following immunization. Please take note, though, that reporting a serious adverse event after immunization doesn't necessarily mean that that event followed, or rather was a result of vaccination. As an example, let me just use as an illustration the possibility that somebody who is vaccinated today might have a dog bite tomorrow, and because of a concern about avoiding rabies, if this person reports to the hospital to obtain his or her rabies vaccine and a vaccination history with COVID-19 will be elicited, that rabies vaccination will be documented as an SAE counted against the COVID-19 vaccine. So the system is just really set up to be extra careful to capture all these different events, even if they're not causally related. And this is really the reason why when you see the communications materials coming from the DOH, they would say 0 deaths coming from vaccines, even if we have SAEs being reported. Because an SAE, or a serious adverse event, is not necessarily caused by the vaccine. And in many, many instances, they are coincidentally associated. So with that, let me just summarize some conclusions. First, unfortunately, local and community transmission of the Delta variant has already been detected. And because containment is, or rather because Delta is highly transmissible, containment is critical. And to be able to contain this variant and other future variants effectively, it's very important to be vigilant, to continue to comply with our minimum public health standards, to use the extra layers of protection that ventilation and vaccination are able to provide, and continue not just to care for ourselves, but our communities by complying with these measures very strictly. So with that, let me thank you for your attention and turn the floor back to Dr. June for the question and answer session.
Thank you, Dr. Anna, for such a comprehensive and educational lecture. I'm sure everyone enjoyed your talk as much as I did. I know there are a lot of burning questions from our viewers, and we will read them after our next speaker. To give a reaction to Dr. Anna's talk and talk about the DMCI's commitment in helping the community battle COVID-19 is the Associate Property Manager of Xenia Towers, Mr. Mike Norgel Apostol. Welcome, Sir Mike. The floor is all yours.
Thank you, Dr. June. Hello, good evening, everyone. Yes, I really do agree with the message relayed by our speaker, Dr. Anna. Thank you. You know, it is very important to have this kind of information coming only from reliable and trusted sources. So thank you to our speaker, the organizers, Flair Towers community, and DMCI Homes for having this kind of forum for us, especially for our residents that serves as one of our references during this COVID-19 pandemic. Now that most of the countries have numerous variants of COVID-19, I think we really need to take all these safety measures seriously, including our chance of getting vaccinated against COVID-19, wearing your face mask and face shield properly, and coordinating to health authorities when you feel sick or you have tested positive for COVID-19 will greatly help our communities. I just have to share this one lang, no? I myself decided to get vaccinated not just because of my safety, but with all the people around me, those that I work with, and to my parents who are actually both with comorbidities. I believe being vaccinated is one way of showing that you care. So if there will be a chance for us to be vaccinated, please consider and take that opportunity. I think it is also worthy to note, and I have to highlight and commend all of our DMCI Homes communities, their PMOs, Community Development Council, and of course our community personnel for giving their very best to take the lead on ensuring that their respective communities will be compliant with the rules set forth by the national government, the IATF, and their respective LGUs so that the community's well-being and safety will be prioritized. Seeing their efforts from giving comprehensive and informative communication materials, innovative and safe community engagement activities, health and sanitation programs, and most recently, for providing community vaccination programs for their residents and community personnel. The teamwork of PMOs and the residents clearly shows unity during these challenging times. Personally, this forum is a learning opportunity that allowed ourselves to have more time to be educated and be informed during this pandemic. It is so nice to see that there are a lot of viewers tonight listening to this very informative session. So I hope that there will be more of this in the future. So again, thank you and congratulations to all the people behind this program. Stay safe.
Thank you, Sir Mike, and we congratulate you for your outstanding service to the Xenia community during this pandemic. Now we go to the question and answer portion. We will be assisted by two doctor facilitators, both members of the Flair Towers Health Advisory Task Force. They are Dr. Ace Felix, an obstetrician, gynecologist, sonologist, and she specializes in childbirth and reproductive health. We also have Dr. Hans Isguera, a board-certified internist and an occupational medicine consultant affiliated with the ABS-CBN clinic. Now, I bring back Dr. Annalisa Onglim to our question and answer portion. Dr. Anna, welcome back.
Hello, June. Good evening.
So we would like to really thank you from the bottom of our hearts, from the DMCI community, that you took time to be with us for this first health webinar from the DMCI community, as I know you are very busy doing your duties with Department of Health and with the IATF and also taking care of your own patients. So really thank you. So,
it's my pleasure.
So Dr. Anna, I think what we'll do is we'll start the ball rolling and we'll start with the first questions that we have here. So for our first question, we know that the Delta variant is more transmissible and deadlier. Are there any extra measures in addition to the standard health protocols and vaccination that we need to adopt to up our game in fighting the Delta variant? So how do we get ahead of the virus, Dr. Anna?
That's a really interesting question, no, Dr. June. I think consistency is one key factor that we can practice to ensure that we continue to be protected. I'd like to share, we as medical professionals, so Dr. Hans, Dr. Ace, Dr. June, myself, we actually don't do anything differently between the first exposure that we had for COVID earlier last year until now with Delta. We just continue to wear our PPEs consistently. And I mean, by God's grace, hindi pa rin tayo nahahawaan, di ba? So, yun nga lang na araw-araw parati nating ginagamit yung PPE. Siniseryoso natin yung paggamit ng PPE. Siya na rin talaga yung naging key to our protection. And I think, kung ganoon din ang mindset ng karamihan ng tao, pagtsatsagaan lang yung paggamit ng PPE, malaking tulong. Ang problema kasi, aminin na natin, marami na ring napapagod, nagsasawa, naiinip, no? And hindi unusual para sa ating makakita ng mga taong naglalakad sa labas na nakalabas yung ilong or nasa baba na yung mask, no? And pag nakikita mo yun, medyo nakakadismaya talaga. Kasi tayo naman bilang healthcare professionals, ano bang ginawa natin? Kung hindi parati lang nakalapat yung face mask sa mukha at parati lang tayo naka-face shield. And for the most part, most of us continue to be protected. So yung consistency, wag lang pagsawaan, malaking bagay na yun.
Thank you, Dr. Anna. I guess consistency is the key. So our next question is also very interesting. Assuming that we have reached the herd immunity and there is enough vaccine supply in the Philippines, there are now studies pointing, I think like in Israel and other countries, pointing to the waning of the level of antibodies after a certain period of time after vaccination, like around 6 months. During this time, assuming those assumptions are met, is there already enough evidence to recommend a booster dose in the near future, Dr. Anna?
Medyo mahirap na tanong, no, Dr. June. If we observe the trends from different countries, makikita natin na medyo nagkakanya-kanya ngayon. May ibang mga bansa na nagre-recommend na ng boosters, pero nakikita naman natin that they recommend only for specific groups like elderly or immunocompromised, while there are other countries who have adopted a more conservative wait-and-see attitude. No? So I think for me that shows that there's a lack of consensus at this point, and because really there's so much more to learn about COVID and the COVID vaccines. Siguro, let me just highlight some points that are being considered in this decision-making process. Unang-una, let's understand that there is no set correlate of protection at this point. Ano ba ibig sabihin nun? Wala tayong isang level ng antibodies na sinasabi natin ay mag-i-indicate na pag naabot mo na yan, protektado ka na. No? Sanay na sanay tayong makinig tungkol sa hepatitis B vaccination. Marami sa atin kinakailangang magpa-hepatitis B titers na hinihingi ng ating mga trabaho. Yung magic number doon, I'm sure alam din natin, pag nakita natin yung 10 milli-IUs per ml reactive, okay na. No? Walang ganong numero for the COVID vaccines. Kung nakapagpa-test man tayo at nakita natin yung antibody levels, kaya 100 yan or 10, hindi natin alam kung alin ang protective. No? So unang-una na yun. Pangalawa, antibodies don't make up the entire story. Meron pang iba't ibang sangkap or components ang ating immune system na nagtutulong-tulong para bigyan tayo ng protection. Very vital yung cellular immunity, which we have no practical or easy way of monitoring or measuring. So we don't know the contribution of cellular immunity to the mix. We don't know what's happening to it in easily measurable terms. So putting these together, we don't have a correlate of protection. Even if we're observing that some antibodies may be waning, we don't know whether cellular immunity is going to contribute or how large the contribution of cellular immunity will be. So if we don't have that kind of information, it will be very difficult to make a large-scale recommendation to say, o sige, mag-booster na tayo lahat. Okay. Now, that's one portion of the equation. Yung isa pang isipin natin, tanggalin na lang natin yung consideration ng challenging supply. Hindi nga ba ang purpose ng booster is to prevent the risk of getting sick? Bakit tayo magkakasakit? Hindi nga ba dahil maraming kumakalat na may sakit sa community? So boosters lang ba ang paraan para mabigyan tayo ng karagdagang proteksyon? Hindi naman, di ba? Kung bawasan natin yung kumakalat na sakit sa community by making sure that more people get their primary series, then you get the same impact. Hindi ka lang bawas ng risk nung mga nabakunahan na nabigyan mo pa ng proteksyon yung mga tatanggap pa lamang with the same end effect. Lahat ng rates of disease will go down because you have more people being protected. So there's more than one way to approach this equation. Hindi lang boosters ang sagot to address the risk of increased disease because of waning immunity, so to speak.
Thank you, Dr. Anna, for that great explanation to what you said is a difficult question. So our next question is, one of the preventive strategies to reduce transmission is layered protection, like wearing face masks and face shields, akin to the Swiss cheese model, right? So I think earlier this year, fueled by personal biases of politicians that you see and hear on TV, we saw opposition to the use of face shield. Even here at our own backyard, who wanted to stop wearing face shields in our common areas. So for the education of everyone, what data do we have to support the continued wearing of face shields in addition to face masks, Dr. Anna? Kasi I think this has been a controversial issue with a lot of people saying it's so inconvenient to wear a face shield. Why should I wear a face shield if I'm already wearing a face mask? So what is the data on that?
Well, the studies that looked at the extra layer or the extra protection that face shields will offer show that there's an additional 5%, I think, protection that putting on a face shield will be able to provide. I think, the real life example is really, again, looking at healthcare professionals. I think Dr. Ace, Dr. Hans, Dr. June, and myself, we will not go into a COVID area without a face shield. Diba? Takot lang namin. So kung kami natatakot, sa tingin ko, may pakinabang yung mga face shield na yan. Hindi siya perfect, syempre. Meron ng mga siwang diba? Pero at least yung nandoon sa harap mo, natulungan ka, nabawasan yung risk ng droplet transmission. So, yun nga yung Swiss cheese concept Bawat layer, dagdag. Kaya tinatawag na Swiss cheese kasi 'di ba ang Swiss cheese slices may mga butas siya. Basta wag lang mag-align yung mga butas, hindi makakalusot yung virus. So ang ginagawa natin, dinadagdagan natin ng napakaraming layer para mas lumiit ang tsansa na makalusot yung virus. Now, understandably, inconvenient. Lalo na ngayong umuulan, no? Pag nasa labas tayo, pagka medyo poor yung visibility, it's quite difficult. Actually, the original recommendation was, kung nasa labas, baka pwedeng optional ang face shield. Tapos indoors, i-require. Kasi nga yung ventilation as an additional layer of protection, di natin masyadong maasahan pag indoors. Pero these decisions, they're not all just based on what science is able to prove. There's also the issue of implementation. And alam nyo, yung face mask nga lang, hirap na tayong i-implement. Gagawa pa tayo ng iba't ibang rules para sa face shield. So yun yung mga iniisip din ng decision makers. But I have to say that the dialogues are continuing. We're still looking for an opportune time to try to push the agenda again. Pero siguro kung ngayon ang usapan is itutuloy ba natin ang ECQ or pagtatalunan ba natin yung face shield, parang mas mahalaga yatang pag-usapan muna yung ECQ bago yung face shield, di ba?
Thank you, Dr. Anna. If I remember, was there a study also in India that was done in which the addition of face shield in addition to face mask actually reduced the incidence of infection among healthcare workers?
Yes. So, Dr. June, that was an observational study. There were cohort of healthcare workers in India whose assignments actually was to go from house to house to do contact tracing, if I'm not mistaken. And their initial gear was actually just composed of face masks and nothing else. No, so obviously they got a lot of infections, and part of the remedial measures that were implemented by the organization was the addition of a face shield, which definitely lowered the rates of infection among their healthcare workers. So although this is not a very large study, it's observational, but still it actually provides additional real life evidence that it's helpful. So I think in this context where we want all the protection we can get, bakit naman natin hindi pa kinabangan itong particular na item na to na napakabilis naman gamitin? Or hindi naman sobrang hirap, I have to say, kasi may mga tao talagang they have a difficult time dealing with it because of visibility. But I guess for the most part, kaya namang pagtiyagaan.
Thank you, Dr. Anna. At this portion of our question and answer, I would like to welcome one of our facilitators, si Dr. Ace Felix. Dr. Ace, kumusta dyan? Dr. Ace, I think you're muted. Could you unmute yourself?
Okay. Thank you, Dr. June. Good evening, everyone. Hi, hello to DMCI communities, and thank you for inviting me here. So, and by the way, thank you very much to Dr. Ong Lim for a very informative lecture. So, let's get the ball rolling. The first question here is an OB-GYN question. I think she is an OB-GYN. For the Philippine Obstetrics and Gynecology, 14 weeks AOG is the recommended age for vaccination among pregnant women. But we get patients that they are vaccinated during the first trimester because they didn't know that they're pregnant. So is it okay to delay their second dose? And if we can delay them, how long?
Okay, that's a very good question, Dr. Ace. We know that sometimes the determination of pregnancy can be delayed, no? And marami talaga sa ating mga kababayan, they went to have themselves vaccinated without realizing that they'd already missed their menses and they were pregnant.
Sometimes because it's too early pa, they don't really know they're pregnant.
That's right, oo. So, ito siguro yung isang magandang maintindihan. Yung mga bakunang ginagamit natin ngayon, they're all inactivated vaccines. So, meaning, they're made up of dead virus or virus particles. So therefore, if they were even to find their way into the developing fetus, walang paraan na mabubuhay siya at magpapakarami dun sa katawan ng baby to cause any harm. So the only reason why we actually want to reserve vaccination to the second or third trimester is just really to avoid any concerns that the vaccination may have caused spontaneous abortion or any abnormalities. Kasi alam naman natin, kahit hindi tayo nagbabakuna, yung pinakamataas na rate ng pregnancy loss ay nangyayari during the first trimester. Yes. So iniiwasan lang natin magkaroon ng wrong attribution, no? Para wala nang masyadong maraming pinag-uusapan na, ay naku, baka yung bakuna yung naging source ng problemang yan.
True.
Now, having said that, dahil wala namang safety issue, may mga kategorya ng pregnant women na pinapayagan nating magpabakuna kahit sa first trimester. Let's say there are healthcare workers na really essential, hindi pwedeng umalis sa trabaho during their first trimester. We counsel them. We show them the risks and benefits, and many of them actually choose to be vaccinated without any problems, no? So again, hindi safety ang issue. It's really just misattribution. So pwede bang i-delay? Let's say nandyan na, nabakunahan na. Tapos hindi pa umaabot dun sa second trimester, pwede bang i-delay? Pwede naman. no? Wala namang problema kung medyo humaba yung interval beyond the recommended. But of course, we want to comply as closely as possible with what's recommended.
Okay, thank you for that answer. And another question here is from Mr. Nilo Baranda. Hello, Mr. Nilo. Thank you for this question. His question is the Delta variant virus transmissible through vaping? It's not the same as cigarette smoke. It's water vapor coming from the lungs.
So, actually, hindi lang Delta siguro. No? Maybe the way I will answer this is, kung yung hininga nga natin, pwede kang maglabas ng virus. Siyempre, kahit na anong klaseng paninigarilyo, whether that's regular smoking or vaping, you will expect that you will generate virus particles. So, kaya din kailangan yung pag-iingat, di ba? Both on the part of people who are already infected and the people who are around them, or kahit sino man, kahit tayo, na we might be encountering people who are positive.
Yes, yes. And aside from that, we can spread.
Dr. Ace, nakamute po kayo.
Okay, question number 3 is from Mr. Ed Patron. Hi, Mr. Ed. Thank you for your question. His question is, kind of layman, there was a reported 17,000 plus COVID victims today. How many are Delta variants in this 17,000?
Okay. Nabanggit ko kanina, Mr. Ed, na ang sistema natin to determine kung anong klaseng variant, no, ang kumakalat ay hindi based on individual testing. No? So ang ginagawa natin, throughout the country, meron tayong ina-allocate na quota para sa bawat region. Let's say that's 100 samples from this region, another 100 samples for this region. Kasi ang bawat run natin is about 750 samples. Liban doon, no, pumipili din tayo ng mga particular na special groups like mga taong nabakunahan na and yet nagkaroon ng infection. Clusters of cases. People with very different presentations, very severe disease, no? Dahil ito yung inaakala nating malamang caused by variants of concern. So, mahirap nating sabihin kung ilan dun sa 17,000 ay Delta kasi hindi naman natin tinitest for whole genome sequencing ang bawat isa doon.
True.
Hindi natin din kailangan siya gawin kasi wala naman siyang impact on individual patient management. Kaya kumukuha tayo ng sample para maintindihan natin kung ano ba latag nito sa buong bansa at yun ang ginagamit nating information. Currently, no, out of the more recent sampling sets, parang umaabot na tayo sa mga 50% ng whole genome sequence ay Delta. Halos katulad to ng mga nakikita sa ibang bansa na nagsisimula sila with a very small proportion, 5 to 10%, tapos eventually dadami yan, 50 and then eventually 80 to 90% of what you sample will be Delta.
Thank you very much, Dr. for that answer. Very well said. So I think it's Hans' turn.
Okay. Hello. So at this point, may I call on the other doctor facilitator, Dr. Hans? I understand you have a few questions for Dr. Anna from our viewers.
Hi, Doc. Hi, Doc Anna, and hi to the whole DMCI community. Good evening to you guys. Can you hear me clearly? Am I being received clearly? Okay, there we go. We have a lot of questions actually coming from the YouTube page from our chat box. So I would like to pull out one question first, and this has been asked several times already. Hi, Doc. This is coming from Miss Lara A. Hi, Doc. Hope you could answer. Is it safe to conduct large-scale examinations like board examinations with the height of the Delta variant? What is the likelihood of it to be conducted? And we have, well, not all are vaccinated po. Thank you.
That's actually a question that's actively being shared now, and I've actually received a lot of queries along those lines. Yung process kasi na ginagawa ng IATF for board examinations is quite meticulous. Ang ginagawa is that the PRC board that's in charge of a particular exam is the one that asks for permission from the IATF. Sila ang nagbibigay ng schedule, no? And yung kanilang process that they're thinking about performing, and the number of examinees that they're considering to accommodate. Tapos nire-review nung technical working group yung process na kanilang pinopropose at nagbibigay ng approval depending on the submission. Now, natural, dahil tayo ay nasa ECQ until today and in-announce na naman na MECQ tayo for the next 2 weeks, no? Na hindi papayagan ang large-scale gatherings under those restrictions. Pero hindi pa naman natin alam kung anong mangyayari in the next few months, and it's entirely possible na maaring payagan under very strict controls. Nababanggit, no? I don't mind saying, nababanggit na pine-prefer sana na bakunado yung mga magpa-participate. Nga lang ang problema kasi, yung mga nagsisi-board exam, malamang mga nasa 18 to 30, 20 years old ang mga yan, at hindi pa sila nagto-qualify for vaccination kasi they will probably be in categories B or C, no? So mahirap mag-impose ng requirement na you should be vaccinated kung wala tayong maibigay na access sa lahat ng tao. So those are some of the considerations. I think if this is a specific concern, makakapag-exam ba ako, kunwari yun ang tanong, I would suggest that the best way to find the information is to coordinate or contact the PRC board that's in charge of your specialty or your profession and find out what their plans are.
Yes, I agree with that, Doctora. So there are several instances na po talaga na kailangan na i-coordinate natin with the specific departments para makuha natin yung sagot for that, because kinakailangan din na ma-ensure yung safety ng lahat na mag-take ng examinations. So thank you for that. We have another question. This one's coming from Ma'am Nina Manlapas. Hi, Doctora. Can we also consider having flu vaccine on top of COVID-19 full vaccination? And a follow-up question. When can we get vaccinated against other diseases before or even after COVID vaccine?
Okay, that's a really great question, Dr. Hans. No, even if our focus has been on COVID, we have to realize that all these other vaccine-preventable diseases have not gone away. They continue to lurk in the background. They're waiting for an opportunity to infect us, especially if we are not protected. In the pediatric population, I'm very sad to share with you the fact that in the Philippine General Hospital, we've had several cases of tetanus. We had one recent case of pertussis. And diphtheria has also been on the upsurge. So these are vaccine-preventable diseases that we don't expect to see anymore because kids should be vaccinated with a DPT vaccination, but our coverage is a dismal 18% up to the third quarter of 2021, when we should already have reached 75%. No? So, ganun katindi ang impact ng COVID sa ating public health vaccination program. So tayo, kunwari meron naman tayong resources and access to other vaccine-preventable, to vaccines against other illnesses, please consider to be vaccinated. In particular, may bagong study with respect to flu and COVID. No? Sinasabi natin parate, ang bakuna ng COVID prevents COVID, ang bakuna ng flu prevents flu. Pero may bagong pag-aaral ngayon na yung mga pasyenteng nagka-COVID na nabakunahan against flu seem to do better compared to those who were not vaccinated. So parang may konting additional protection na naibigay yung flu vaccination dun sa mga nagka-COVID. So ano ba ang mga kailangan? Typically, these are age-based recommendations. So you can consult with your physician para mabigyan kayo ng schedule na babagay sa inyong risk profile. At typically, we allocate a 2-week interval between the COVID vaccination and receiving other vaccines. Again, only because we don't want to get confused. Baka naman kasi magkalituhan kung ano yung naramdaman, saan ba nanggaling. No? It's really more to prevent misattribution rather than a safety or efficacy concern.
Okay. Thank you for that, Doctora. And I agree with you on that because, of course, always we need to take note of the benefit versus the risk. In terms of these conditions or these diseases that would actually target the young ones and the immunocompromised patients, lalo sa mga families natin, ayaw rin natin sila maput at risk. So thank you for that. We have another question, and this one's a good question for those who are actually living in condominiums like ours. No, is it safe for COVID positive patients to quarantine at home to keep their exhaust fans on when these exhaust fans blow directly onto the hallways where people pass?
Well, that's a very difficult question to answer, no? Kasi dapat to be safe, no? Sana yung mga exhaust fans are blowing outside of public areas. I would think, no, this is an important aspect for building management to consider. Kasi kung nakaset up na as such, no, yung ating exhaust systems, then some mitigation can still be done, perhaps by ensuring that ventilation along hallways is well maintained. Yun lang naman talaga yung key. And may paraan naman tayong magsukat ng ventilation. No? We can either use anemometers. No? HVAC specialists know how to do this. Or pwedeng gumamit ng CO2 meters para gamitin as surrogates for whether an area is well ventilated or not. So I would think that this is something that building management can take an active concern about so that everybody's safety is addressed.
Yes. Thank you for that, Doctora. And I think we have several more questions. Doc June, can we still ask some more questions, Doctora? Do we still have time?
Hans, okay, let me come in, and there's a couple of questions that we need to ask Dr. Anna, and we'll go another rotation. So I think yung next question, Dr. Anna, I think it's like a composite of several questions on antibody testing after vaccination. So we have a person who commented na one of his aunts daw who was vaccinated in May, and then nirecommend daw ng doctor niya to get an antibody level to determine the efficacy of the vaccine. And I know in some hospitals it is available, right? But then as far as I know, parang the neutral, as you said, yung neutralizing antibody has not been really proven to say that will protect you against the virus. So anong advice mo sa mga patients natin, sa mga nanonood natin, just in case na they may be advised by their doctor, o pakuha kayo ng antibody level dun sa selected hospitals, kasi only selected hospitals will have those antibody levels. What response do you want them to tell their doctor? Napakinggan ko yung webinar ni Dr. Anna. Ito yung sinabi niya. Para I guess para rin we want to educate the patients din, di ba? Parang dapat evidence-based medicine din yung alam ng mga patients natin. What do you think, Dr. Anna?
I think the bottom line really is that there is no correlate of protection. Yun naman ang pinaka-problema natin ngayon. Pwede naman tayo magpa-test. Wala namang mawawala, di ba? May resources ka naman. Pero you have to treat it as FYI. We don't know whether those numbers actually assure us that we're protected. Whether they're, and that will define the correlate is not yet available. So I think if you're advised to do antibody testing, then just understand that those numbers are filed for your information. It doesn't really tell you whether you're protected or not because we don't have that level against which we can measure protection rates.
Thank you, Dr. Ana. This one is a very, medyo, parang breaking news question, and I want to ask your input, and we don't want you to be in trouble for it. It's just your personal opinion. Today, we had the highest record of more than 17,000 new reported cases, the highest since we had the pandemic. And then at the same time, we are actually switching from ECQ today to MECQ tomorrow. So I know there's a lot of factors involved in the IATF to decide whether we should go for ECQ or MECQ or maintain ECQ. What are your personal opinion considering that our cases are still going up and yet we are downgrading it from ECQ to MECQ? So just your personal input.
Siyempre nakaka-anxious makakita ng mga ganong klaseng numbers. No? I'm sure many people are worried. Siguro some considerations for people to think about. Number one, whatever we do now is actually reflected 2 weeks down the line. So the numbers that we're seeing, that 17,000, are the result of us having GCQ with heightened restrictions. Ito yung result nung right before the ECQ was implemented. Okay, so maybe that helps us have a little bit of perspective. Number two, and I think this is really the bigger problem. Naramdaman nyo ba na nagka-ECQ tayo ngayon? Sa totoo lang. Parang hindi, di ba? Parang walang nagbago. So, kung iisipin natin, ano ba naman yung point na ulit-ulitin mong sabihin, ECQ tayo, pero wala namang nakikitang pagbabago? Hindi kaya dapat ang ating strategy, if the overall goal is to limit mobility, diba? Yun naman ang gusto nating makita para ma-limit yung transmission. So, hindi na nag-work yung ECQ for whatever reason. Baka ang dami kasing nabigyan ng APOR pass. Lahat na lang exempted na. Diba? So, hindi ba dapat natin tignan ngayon, sino ba yung mga pinapayagan nating lumabas? Baka yun na lang ang ilimit natin. Without penalizing those people who really need to go out, who really need to work. So this is actually a different approach, working smarter, no, to be able to achieve the same goal. We have to understand din kasi na iba yung sitwasyon natin ngayon kumpara dun sa months ago or even last year. Nung nagsabi tayong ECQ, lahat talaga napakabait na sa bahay. Ngayon, iba na, no? And unfortunately, behavior is a very big factor in compliance. So I think we need to be open to considering other approaches to achieve the same goal. And hopefully, with a more focused, a more targeted strategy to limiting movements, we'll get to where we need to be without having to unnecessarily sacrifice the mobility of people who need to be productive.
Thank you, Dr. Anna. You gave us a glimpse of yung mga discussions nyo within IATF, right, in deciding what type of quarantine. So I will call back Dr. Ace to read a few questions from our netizens. Okay, Dr. Ace, welcome back. Dr. Ace, you're muted.
So it's me again. Hi, Doctora. This question is very close to Doctora Ong's heart. Dr. Lim, the question is for kids regarding children. Hi, Dr. Anna. This question is from a unanimous viewer. Are there tips you can share on how to protect our children while vaccines for them are still unavailable?
Dr. Ace, I'm sorry, my internet got cut a little bit. Would you mind repeating the question?
Sure, Doctora. Are there tips you can share on how to protect our children while vaccines for them are still unavailable?
Oh, okay. So that's really an important question, especially now that we're hearing so many kids or more kids are actually getting sick. No?
Yes.
So in the same way that we want to protect the community by providing everybody who qualifies with their first doses, that's actually the same strategy that we want to implement for kids. We want to implement the ring or cocoon strategy, so that the people who are around children should be vaccinated, should be very active in controlling their exposure so they don't bring the virus home and infect the children in their households.
Okay. Another question here is, how soon will Delta variant transmit to others inside the closed space, for example, in the elevator?
Ako, that's also quite difficult to answer, Dr. Ace, kasi syempre maraming factors to consider, no?
Yes.
Yung size ng area, yung taas ng viral load, yung air exchange in that area, no? Pero siguro what I'd like to mention is that nakikita in some studies na pwedeng fleeting contact lang, segundo, no? Nagkakaroon na ng hawaan. Pero, syempre nakakatakot naman yun. Ibig sabihin, di na ako hihinga pag nasa elevator ako. Usually naman, itong mga nakikita nating ganong klaseng kwento, happen in circumstances where the air circulation is not really optimized. And of course, there was no proper use of the mask and shield. So, kaya nga din, yung Swiss cheese protection or Swiss cheese concept ang ginagamit natin, let's put on as many layers as possible. And yung engineering controls na pwede nating i-put into place, no, like for example, in a closed space like an elevator, ventilation can be improved, dapat din asikasuhin.
Agree to that, Doctor. So the bottom line is following minimum health protocol. So it says if you're wearing face mask, face shield, no, and then you follow the minimum number of people that should be inside the elevator, minimum of 4 persons per elevator, you are 99% protected as long as we follow the minimum public health protocol. So I agree with that. So the next question is, from a unanimous viewer, how worried should we be in bringing in virus in our homes through our footwear when we came from outside and from the packages received via food or item delivery services?
Okay, that's also a very interesting question, Dr. Ace. Kasi nakikita nga natin may mga households, they're very meticulous about cleaning their packages or utilizing foot baths. But in general, yung transmission through objects is not a very important way of transmitting this virus. The example I use is kung talagang importante ang package, dapat siguro lahat ng nagde-deliver at nagtatrabaho sa mga grocery, matagal nang nahawaan. Wala naman tayong naririnig na clusters na ganoon, di ba? So, ang pinaka-importanting paraan pa rin ng pagkalat ng sakit is through droplet and aerosol. That's why we take care of this. Now, the hands, that's the reason why we wash them. Because if you happen to hold an object na may kaunting virus at ginanon-ganon mo siya, di naman tatalon yun galing sa package or galing sa shoes natin, di ba? Kailangan pa rin dumaan sa kamay. So, kaya dapat naghuhugas.
True. So, I agree to that. So, it's all about evidence-based studies said hand washing can reduce the risk of transmission of severe infection. So it's really hand washing and minimum health protocol. So another question, unanimous question. What reminders can you give to residents of condominium to ensure that we are protected from the virus? So again, Doctor, I think it's minimum health protocol. Ano po?
Oo eh. Iniisip ko kasi, so ano ba yung circumstances that are unique to condominiums na hindi natin nakikita sa single detached home? Siguro yung mga common spaces. No? Baka lobbies or mga elevators, hallways, na alam naman natin, siguro in any other building, giingat tayo, hindi tayo maglalagay dun sa mga ganung klaseng lugar, lalo kunwari sa offices natin, di ba, hindi naman tayo nag-hang out na ngayon sa mga lobbies or sa hallways kasi kung may mga ibang tao doon, pwede tayong ma-expose. So siguro magkaroon lang ng heightened consciousness na hindi porket nasa bahay na tayo, the way we treat our condominiums, no, we're home. So bakit ako kailangan mag-ingat? Bubble ko na to eh. Pero in fact, hindi ka home until wala ka dun sa unit mo. Dun sa labas, that's still a public space. So dapat nag-iingat pa rin.
So the bottom line is po talaga, mga kababayan, is minimum health protocol po talaga. Social distancing, face mask, face shield. Okay, and proper hand washing. Okay, so another siguro good thing with DMCI condominium is our condominium is very much ventilated, no? We have big corridors, no? And we are really ventilated unlike the other condominiums. Talagang ang lakas ng hangin. So tanggal lahat ng virus pag humangin eh. So Hans, do you have any other questions there for Doctora? Thank you, Doctora, for those answers.
Thank you.
Thank you, Doc Ace. Hi, Doc. Just one last question to wrap things up. No, this one's actually timely. Then, Doc, just want to ask your input on this. My cousin got her first dose, but after 4 days she tested positive, and she is currently in a quarantine facility. When is it advisable for her to get her second dose?
Okay. It's also quite a common scenario, unfortunately, no, Doc Hans.
Yes,
Minsan, dun sa proseso ng pagbabakuna, syempre maraming tao, minsan dun tayo na-expose. Nakakalungkot, di ba? Kasi dun na nga tayo naghahanap ng protection, dun pa tayo nahahawa. But in any case, kung mangyari man, no, kung naging symptomatic, inaantay natin, once fully recovered yung pasyente, pinapayagan na nating magpabakuna. Ngayon, kung asymptomatic naman at nag-test ng positive, ang inaantay natin is 14 days after the test to resume vaccination. Now, again, no, ang dahilan dito ay hindi dahil natatakot tayong magiging mas malala yung sakit ng pasyente o kaya magkakaroon ng epekto dun sa kanyang proteksyon. Kung hindi, it's just really to avoid confusion and misattribution kasi baka magkaroon ng maling akala na dahilan sa bakuna, yung paglala or kung ano mang maramdaman, no? And of course, gusto rin nating iwasan na mahawaan yung mga nandoon sa vaccination center. Na kung kailan tayo nakakahawa pa dahil kagagaling pa lang natin sa sakit or kasalukuyan pa tayong dapat naka-isolate or quarantine, ay gumala na tayo.
Yes, that's correct. For that question, as soon as the patients recover from the infection or from COVID-19, o pwede na po silang magpabakuna. No? Especially those who are symptomatic and then relieve naman yung symptoms, and those who are asymptomatic who completed the 14 days quarantine period, o pwede na po magpabakuna anytime po yun. Unlike the other, siguro yung mga ibang tao nagsasabi na parang 3 months, may iba may 2 weeks after the infection. So I guess it's clear now that as soon as you get fully recovered from the infection, po pwede na po tayong magpabakuna. And again, thank you, Doc Anna, for your time and for answering all the questions. That was a lot, actually. Doc June?
Hey, thank you, Dr. Ace and Dr. Felix, for helping us read out the questions from our DMCI community.
Pleasure, Dr. June.
Unfortunately, our time is up for question and answer portion because si
It's a
Dr.
lot of
Anna,
questions pa nga sana.
yeah, Dr. Anna is such a sought-after spokesperson and a resource person. She actually has a radio interview at 8 o'clock. So for this, Dr. Anna, we would like to give you our e-certificate and an appreciation from the DMCI community, and we will send it to you via email. So thank you again, Dr. Anna. Any words of hope and last words of hope and encouragement sa atin? Bali, ano ho pwede nating maipayo sa ating mga kababayan sa buong Pilipinas at buong mundo para makapagbigay tayo ng pag-asa at makapagpalakas loob kontra COVID-19? Dr. Anna, last words.
Maraming salamat, Doc June, for this opportunity to address the DMCI community. Alam ko pare-pareho tayong nag-aalala dito sa bagong challenge na hinaharap na naman natin. Lalo na nakita naman natin yung graph kanina Parang medyo nakapagpahinga na tayo ng konti, dumating na yung bakuna. I think lahat tayo umaasa na sana patapos na to. Tapos may bago na naman. Hindi talaga mahirap. No? Mahirap tanggalin yung anxiety. Mahirap tanggalin yung pagkasuya. Siguro yung pakiramdam na pagod na tayo lahat. Ako personally, I feel very encouraged every day just by seeing small victories that happen in whatever setting that I'm in. I continue to see patients. Pag nakakabalita ako ng pasyenteng gumaling, maayos ang ganyan, or meron tayong nakita konting improvement in our communities, nakakabuhay talaga siya ng loob. And I think one thing that we can all benefit from is perspective that God continues to be in control of the situation. Many positive developments have happened. We are not as helpless as before. We have the power to be able to protect ourselves and our families. So let's not feel helpless. Let's continue to think about active ways that we can help our families and ourselves. Continuing to practice the minimum public health standards, getting vaccinated, thinking about ways by which we can stop the virus from entering our homes are really very empowering. And I think these are measures that can keep us hopeful that every day that we face the challenge of COVID-19.
Okay, thank you, Dr. Anna. Maraming salamat ulit sa pagtanggap ng imbitasyon namin. It is really a privilege to have one of the most sought-after experts during the COVID pandemic to be with us sa first natin na health webinar of the DMCI communities. Palakpakan ho natin si Dr. Anna. Dr. Anna. And we wish you sa next interview, which would be, I guess, in a few minutes from now. Salamat, Dr. Anna. Magpapasalamat ho rin kami sa Department of Health at sa The Medical City para sa mga videos na pinahiram nila sa amin. And then I would like to mention yung mga organizers kasi we need to give credit when credit is due dito sa webinar ng DMCI communities. Let's start with Mr. Enrico Wong, si Sir Yek Rapinan, si Kevin Dilan, Mr. Joel Bulao, si Sir Alex De Luna, Erwin Bangit, Rogelio Tatco, si Carlo Comandao, si Ma'am Nelvet Ricalde, mga doctor facilitators natin, Dr. Ace Felix, Dr. Hans Isguera, at ibang members ng Flair Towers Health Advisory Task Force, si Mr. Mike Apostol, thank you. Lalo na sa Flair Towers PMO at higit sa lahat sa buong DMCI community sa pagkaisa natin sa laban against COVID-19. Mag-ingat po tayong lahat at magandang gabi. Mute natin kasi
Group picture.